is brought to you by
Kambanjulire Alowish Organic Natural Health Products ne Hajat Aisha Nakasujja be bakulembedde mu kujjanjaba endwadde ez'olukonvuba nga beeyambisa eddagala ly'obutonde okuva mu bikoola, emiti, emirandira n'ebibala. Alowish Organic bali ku Shua House Plot Nambe Mpombo Road oba ku HBT Complex Rashid Kamis Road. Essimu 0414 69 29 43 oba 0752 94 0747. Alowish Organic, your health is our #1 priority.
Hello, my name is Mary. Welcome to Health Facts on UBC TV, Inspiring Uganda. Today, we are at Chibuli Muslim Hospital and we're here to learn about FACO Web training. What is this training all about?
Yeah. First, I thank UBC to come to cover this event. This training is a training for our colleagues, for the doctors, for the eye doctors, for a special procedure in cataract removal called phaco emulsification. This procedure is an advanced procedure done with a machine. Simply, before we do the surgery, the cataract surgery with the open surgery, we open a very big wound, and deliver the cataract, this opacity as a whole. It is very big and come from a very big wound, and we suture this wound and put a hard lens inside the eye. In the new technique, we go inside the eye with a phaco machine, with the ultrasound machine, and eat the cataract inside the eye. We go from a very small incision, and eat the cataract inside, and then we inject a foldable soft lens inside the eye through the injector from this very small opening, and we finish the procedure without any sutures, and the eye is formed, and the patient can see from the next day of the surgery.
You just talked about cataract surgery.
Yeah.
What is a cataract, first of all?
Yeah, the cataract is an opacity of the lens inside the eye. The opacity of the human lens. With the age, the most important cause is the aging process. 90% of our patients are getting the cataract with age. And some from other diseases like the diabetics, the cataract comes a little bit earlier. If the patient on corticosteroids, on cortisone, it comes, a specific type of cataract comes earlier, but all the types of cataract are treated in the same way, with the phaco emulsification.
You just mentioned aging.
Yeah.
What age group are we talking about?
Most probably it starts in the 50s, and to 70s, 80s. Yeah, you can get a patient. I did many patients over 90.
So, what is the main aim of this training?
Yeah, the main aim. First, when we are start to learn a new technique, you have to master the steps of this technique, and so you have to go in the stages of learning of any skills. There is 5 stages of learning of any skills. First, to watch. To watch what is the procedure. Someone senior, you see what is he's doing. He's doing so and so and so. This step, he did it in this manner. The second step, the third step, the fourth step, to watch. Second, to imitate. To imitate what he's doing. Imitation, just imitation, no creation. Just imitate. I do like what I see. And then practice. After some time of imitation, I start to practice. I do these steps more easier. And then the fourth stage of learning is the stage of perfection. I do every step perfect and very easy. The fifth step and the last step of learning is the stage of creation. I create my own technique. I do, no, this way of doing this step is not good. I will create another way to do this step. This is a stage of creation. And so when you learn skills of surgery, you will do this surgery on a patient. And so if you did mistake, you will harm the patient. And so what we do, we learn, we take the first stages of learning on a model eye, artificial eye. It is this type of learning is very expensive and costly, but it is very safe for the patient to do a mistake in one step on an artificial eye. It is much better than to do on a patient. Okay, and so we take these early stages of learning the technique on an artificial eyes, and when the doctor start to master the technique, we shift to do the technique on the patient very safely for the patient.
Okay. So when you came up with this training idea, did you have any support with, anyone who supported you to put all this together?
Yeah. Actually, we had a meeting of the COXA. The COXA is the College of Ophthalmology of Eastern, Central, and Southern Africa. This is a college concerned with the training of the doctors. We have a joint meeting with them. We are the organizer of the meeting, and they are joined us. They are very supportive for us. They helped us in announcing about the event and getting the names of the doctors and announcing the doctors about the importance of getting such a training. And so we are very satisfied with the meeting because many of the doctors, around 30 doctors has attended the meeting on Saturday, and till now we are about to finish training, wet lab training for 9 doctors, and this very big number to train in 2 days. This is a practical training.
It's practical.
Because our model eyes like the eyes of the patient, exactly like the cataract, the same structure, the same hardness, the same. Everything is the same. This model eye is very expensive. It is a Japanese product. Okay, it's very expensive and very, very. What I can say, it is resembling a good eye, an actual eye of a patient, a normal eye of the patient. The cornea, the capsule, the iris, the cataract. Even the cataract is different hardness as we see in the patients. This is a soft cataract. This is a medium or moderate hard cataract. This is a very hard cataract. We have the same sequence in the artificial eyes. And so it is a wet lab training. It is a practical training. He will do the same exactly. He will face the same situation in front of the patient. But if he did a mistake, he will did a mistake in artificial eye. No problem. Okay. When he masters the technique, okay, everything is perfect. Every step he did it perfect. He can go to the second step to operate a patient. Okay. When he masters the technique. My expectation, we give the doctors instructions after finishing the course. What is the next step to do? Okay, the next step to watch and watch and watch. Okay, from videos on the YouTube or go to your senior that do this technique perfect and attach and stick to him. Okay, and learn from him how he do this step and the second step. Be attached to this. Don't get the wet lab and go and forget the sub. You will not get benefit. What is the benefit? You practice now in the wet lab and you go and see and watch. Okay, and then stick to the senior. Okay, and start to do your patients. Okay, under supervision of your senior. Okay, after some stage you come to the practice. You practice by yourself, but the same steps you don't create. Okay, till you do a number of patients, you will come to the stage of perfection. You will do this technique perfect way. Okay, and then the stage of creation. You will create your own technique, your own steps. Okay, to be safe for the patient and to the patient to get the best benefit from your surgery.
Okay. You talked about cataracts. When does one need to see a doctor? Like sometimes our eyes are paining, maybe I have a running eye or something. Do I have to go and see a doctor and like operate my eye?
Yeah. Simply, the cataract is an opacity in the human lens inside the eye. And so normally the media inside the eye is clear. And so the light comes from the object, comes to my eye, go through a clear media, clear cornea, clear lens, clear what's called vitreous, to go to the retina, to the center of the vision. And then the photo will be transmitted from the retina to the optic nerve to the brain to realize what I see. Okay? This is the normal conditions. Okay? With the cataract, there is an opacity delivered inside the eye. Now there is an opacity in the media. There is opaque media, and so the light comes from the object or the photo and comes to the clear cornea, comes to the lens. The lens is opaque. and so it cannot pass to complete the way to the retina, or it comes to the retina, but it is vague. Okay, and so I see the things not so clear. Okay, and this is the symptoms of the cataract. I don't see the eye, don't see proper. Okay, don't see at all. It don't see proper. Okay, if I have this complaint, I have to check with the doctor. This diminution of vision may be related to other
something
causes.
else,
Like glasses. I am short-sighted, I am long-sighted, and so just I have to put glasses. Okay, and maybe related to other conditions. The retina is sick. Everything is clear, and the retina is sick. Like in diabetics, we have in diabetics some diabetic retinopathy, some changes in the center of the vision and in the optic nerve in the back of the eye. Okay, that makes the vision poor, but the media is still clear. Okay, and we may have this cataract. Okay, the media is not clear, and so the doctor will examine the patient and see this is a cataract, this is dense cataract, or very fine cataract. Okay, if the cataract is is not so dense, is not dense as it prevents the vision, we can wait and follow. Okay, if the cataract is dense, okay, and affecting the vision, the doctor recommend to do the surgery.
Okay.
And whatever the cause of the cataract, it is related to the age, it is related to some medications like cortisone, it is related to some diseases like diabetes. Okay, it is done in the same way. Okay, we go with, we did it with ultrasound. We open a very small opening, this new technique, the phaco, okay, and they go inside the eye with a phaco probe, with ultrasound probe, and they eat the cataract inside. And when we finalize to remove this opacity, this cataract, okay, the media now is clear, but we are in need to replace this lens which we have removed with another lens, okay, with a specific power calculated before the surgery with this ultrasound machine. Okay, we calculate the power. This patient needs plus 19, this patient needs plus 20, this patient needs plus 23. Okay, according to the patient, we do these measurements before the surgery, and we prepare his lens with this power, with a specific power, and they inject it inside the eye. It unfolds inside the eye to be a real lens. Okay, at beginning situation, the media, all the media is clear now. We remove the opacity and put an artificial clear lens.
Okay, thank you very much for that information.
Yes.
And if it wasn't because of time, I would go on to talk about cataracts.
Yeah.
So you just gave one sign of cataract. Can you tell the viewers who are watching more of these signs?
Yeah. The most important sign is diminution of vision. Why? Because the diminution of vision has many causes, and I want to realize what is the definite cause of this diminution of vision. This is the first. This is the first and the most important sign. Okay. The second sign is to see the things double with one eye. Okay. The third is the glare. When you go, you look at a source of light, you will see sparks. You cannot realize the object itself. Okay. While you are going in the daytime. Okay. With the sun light, it becomes a glare. Okay, you cannot see from this glare. Okay, the other sign is the blurring of the vision. Before you see the television very clear, now with the cataract you see the television blurred, and the translation, the small translation, you cannot read.
You can't read.
You were reading before. Okay, now you cannot read. There is a problem with the vision.
Okay. Are cataracts preventable?
Not preventable.
They are not preventable.
Yeah, some talks about some antioxidants, some multivitamins, but it's not preventable. It's an aging process.
Okay. Once you have them, you have to operate them.
Definitely, and the only treatment for the cataract, we haven't a medical treatment for the cataract. It is an organic lesion, and so we have to remove this opacity, and we cannot treat this opacity.
Okay.
We can't make the lens clear again. Okay, it is like a denaturation of, it changes the nature of the lens proteins. Okay, any protein even outside the body. Okay, if you boiled an egg, okay, you change this white, this clear material of the protein of the egg into a white material formed. Okay, you cannot you can regain it to the original.
That is true.
This is exactly what happens in cataract. Okay, the protein of the lens, it changes the nature, called denaturation of lens protein. It is transformed to another type of protein, okay, which is opaque. Okay, you cannot regain it to the original position. You have to remove this opacity and put a lens, a clear lens, an artificial lens inside the eye.
Okay. Thank you very much for your time.
Yeah, you are welcome.
Okay.
Thank you.
Good night.
Thank you.
This is Health Facts, and it's brought to you by Alosha Organic. They deal in natural health products. They deal in oils and creams. So if you want to look better than me, that I'm kidding, you try their product and you look very, very amazing. I'm being joined by Hussam, and he is here to tell us more about the procedure of cataract surgery.
My name is Hussam Awad.
Okay.
I am originally from Egypt.
Okay.
So my profession is biomedical engineer. We are our specialist to assembling the medical devices and train the doctors how to use the devices and how to use the maximum function during the surgeries. And we have another branch. We have like a medical center to train the doctors how to make the surgeries perfectly and get the maximum efficient of the medical instrument which you already using. So now on here in Kibuli Hospital, we are establishing this lab to train the doctors for one of the very important surgeries is the cataract surgery. The only this operation made by doctors, eye doctors,
Okay.
ophthalmologists do these surgeries. This starts with one type of machine, it's very advanced one called phaco machine. And the surgery should be under microscopes. As you know, the eye is very small and the details is very fine. So the doctors need to see it enlarged and to see more details under the microscopes. And the space inside is very, very small. And then even the instrument go inside the eye also is very small. It's micro instrument. So the surgery, all the eye surgeries called microsurgeries also. So this machine called phaco, which we have there at the wet labs, it depends on ultrasound techniques. The ultrasound techniques is with this specific frequency, making breaking or cutting for the lens inside the eye.
Okay.
Because the lens inside the eye is very clear to see everything around you. Sometimes got defect of the lens and not clear anymore. So the doctor need to remove it totally from the eye and insert inside another one made of different type of materials, very special materials to be in the eye as safe and forever. No move or no take off again, or took out. So the operation is very critical,
Okay.
and the machine is sophisticated as well. So the doctors need to take such course to know how to make the surgery with these machines. Before, the doctors and the patient together as a two parties they are, but with the machine now is three parties. So he should be more careful and be aware for all details about the machine. Otherwise, the machine make complication with them, or the machine is not good or not adjusted good. He will face many troubles while the surgery. So he need to take the course for both. How to use the machine and how to adjust carefully and properly, and how to make the surgery perfectly, step by step.
Okay.
So we starting with this course with special eyes. These eyes very similarly like human eyes.
Mm-hmm.
The same distance, the same thickness, very near to the human eyes. So the doctors feel that he is in the real eyes. And you can find also inside these eyes, you can find different type of cataract.
Okay.
This is the disease which our doctor going to do this surgery to remove this cataract outside. What is the cataract? This is the degeneration lens inside the eye. He want to remove it. This is the cataract. How to remove? He used that small incision in the cornea of the eye and go through very small tip attached to the machine, phaco machine, and the tip create ultrasound frequency up to 40,000 cycles per second. This kind of frequency make the lens fragmented, so the lens emulsificated as well, and with the circulation of fluid, get the lens totally from the eye outside after fragmentation and emulsification. So this machine called phaco emulsification to emulsify the lens, the defective lens inside the eye, and get it out completely. And then after thing it would be clear inside the eye, and no lens matter, no more inside the bag of the lens. He's going to use this lens made of acrylic, made of PMMA, made of silicone. But the newest one is the folded one. Rigid is earlier, but now we find the lens is folded. He can fold it and insert inside the eye through the very tiny hole, and then open it again in the bag of the lens. After that, he just relocated and make it in the center, and then close the eye, and the patient after surgery see very clear.
Immediately?
Immediately, yeah, after 2 days, but just to protect the eye for a few days, and follow the post-operative, check everything is okay with some of this instrument. Checking the eye is okay now, and then remove this cover, and he can do his life easily, no problems.
So those artificial lenses you put in the eye?
Yes, very small one, tiny. It's 5.5 millimeters size diameter, and this can insert through the small hole, enter the eye. But the earlier one was rigid, can't fold it. The difference that earlier he need to make large incision, big one, and this incision makes some another side effects because this incision is big enough to make the rotation of the axial length of the eye. So that the patient after surgery maybe had got another disease like the astigmatism, because the axis is not correct after the surgery. But with this technique, using the phaco, just enough small incision to enter the folded lens inside, and the same incision he can take out the emulsificated lens. But the old technique, he need to make a big incision to take the whole lens together inside the eye, because the lens inside we can't fragment it or break it. But now he can cut it, fragment it, and emulsify through the small hole and get emulsified it and aspirate all the materials, lens matters outside the eye. And from the same small incision, he fold the new lens acrylic, and through a specific instrument like injector, like how to inject some medicine. But you inject the lens inside the eye, in the bag, in the proper position, and it folded there, and then he just make a rotation and centralization to the lens, and then everything will be easier.
Is there a possibility that after you've put the new lens, the artificial lens, that you can still fail to get vision?
Good vision. The lens is should be the power of the lens. synchronized with the patient. That means before the operation, the doctors has to make some other measurements. For example, the corneal curvature and the axial length inside the eye. This data he is using to get the power results, because the lens sometimes different from one to other, depends on the condition of your eye. So we measure the condition first and decide which power we are using to this patient, and we get the lens with the power to insert and implant in this eye. This would be perfectly, because he no need for glasses after the surgeries also.
So does this advanced procedure has side effects?
Side effects maybe because of specific cases. Maybe the patient has already another problems inside the eye. But with the normal eyes, no side effects at all. Even with some problems with the eyes, the doctor can manage this problem as well. And it depends on his experience and the advanced instrument he has got. But the side maybe problems improve that the patient has to tell the doctor, telling the doctor that my history is so and so. And the doctors also has to make full examination of the eye before the surgeries. Both they have the principality of these complications. But in case the doctors find any troubles, he will tell the patient that the result would be so and so. The results would be 80%, 70%, or 100%. But normally, with the normal eyes, has no side effects at all.
You heard it from specialists. In case you have a problem with vision, or they tell you, your doctor tells you that you have cataracts in your eyes, it's very simple. Go for that operation. It is successful and there are no side effects. I've been your host, Mary. Until next time, have a very good night. But this show is brought to you by Alosha Organic. If you want to look very nice, I mean, ladies, if you have a rash on your body, if you have scars on your skin, try their products. They're going to make you look better. And if you have diseases like diabetes, they have medicine for that and many more. So go and check them out at Bombo Road Shore House. Have a very good night.
Was brought to you by
Kambanjulire Alowisha Organic Natural Health Products ne Hajat Aisha Nakasujja bebakulembedde mu kujjanjaba endwadde ez'olukonvuba nga beeyambisa eddagala ly'obutonde okuva mu bikoola, emiti, emirandira n'ebibala. Alowisha Organic bali ku Shore House Plot number Bombo Road oba ku HBT Complex Rashid Kamis Road. Essimu 0414 69 29 43 oba 0752 94 0747. Alowisha Organic. Your health is our #1 priority.